Hi, welcome back. I'm Josh with Fishers Health Department here on the afternoon of Wednesday, November 17th, 2021, with our COVID-19 community update. So this is the second week in a row that we have seen an increase in cases. We had quite a long period of just over 6 weeks of decreasing cases until last week when we saw an increase, and then this week we've seen another increase compared to last week. So when we look at the important metrics that we talk about each week, the positivity rates and the case incidence rate, we've seen the Hamilton County unique individual positivity rate increase from 9.9% to 13.2%. The Fishers testing site all test positivity rate is actually decreased from 13.38% to 10.23%. But the case incidence rate has increased again for the second week in a row. It is increased from 21.5 up to 30.07 as of earlier today. Now, this case incidence rate, as you'll recall, is a 14-day rolling average of new cases per 100,000 population. This has increased approximately 82% in the last 2 weeks. 2 weeks ago, this was down to 16.5. This week, it's up to 30.07. So we are seeing another uptick and further transmission and spread in our community. When we look at our testing sites and our secondary metrics, such as test turnaround and contact tracing, we continue to have availability for our testing site. If you need to schedule a rapid test or a PCR test, you can do both scheduling options for those online on our websites. We also continue to see our contact tracing completed in under 24 hours. And we continue to see test results come back within that 3-day time frame. Now, when we look at the tertiary metrics, talking about the healthcare system capacity, we have seen a decrease in ICU bed availability across our region. This is IDOH Region 5, and this decrease is down to 21% as of earlier today. It was getting much closer to the high 20s, 30%, so we'll keep a close eye and see how the hospital bed capacity in our region continues to fluctuate. We anticipate that it will go down a little bit more. And when we look at ICU admissions for COVID, those are increasing in our area as well. Now, we know that the best line of protection against COVID-19 is to go out and get the COVID-19 vaccine. We have a very large uptake of the vaccine in our community amongst those 18 and older. So amongst those 18 and older, they have received at least their first dose. A population percentage of 85% of 18 and older have received their first dose. And so that's really good to see. But there still remains a large number of residents in our community that have not yet initiated the vaccination process. So when we break down these COVID cases by vaccination status and look more closely at the data, we start to see where the cases are concentrating. So the case rates in unvaccinated residents is 5 times higher than the case rates in vaccinated residents. We see across different age bands that this ranges from as low as 2.5 times higher for the 12 to 17-year-olds, and then as high as almost 10 for the 40 to 64-year-olds. And so this is the difference between the case rates in unvaccinated residents in those age bands compared to the case rates in vaccinated residents. So please do go out and get your COVID-19 vaccine. The Pediatric Population, children age 5 to 11, was recently approved 2 weeks ago. We have supply at our site for the Pediatric Population. You can go online and make an appointment. Here very soon in the next few days, we will be expanding appointment availability for the 5 to 11-year-olds. And then if you are older than 11, so 12 or older, you can walk in for your vaccination. If you are 18 or older and needing a booster, we have all of that guidance on our website, and you can also walk in for a booster. We definitely do encourage appointments, but if you're there for a booster or a first dose as 12 and older, you don't have to have an appointment. 5 to 11-year-olds, parents of 5 to 11-year-olds or guardians of 5 to 11-year-olds, do go online, make your appointments, do check over the next few days and look for further expansion in appointment availability at our site. And also do go out and get your flu vaccine. Let's continue to all work together so that we can help slow the recent uptake in spread, take precautions, mitigation measures, and go out and get your vaccine as well. If you have any questions, you can call our COVID hotline at 317-595-3211 or reach us directly by email at healthdept@fishers.in.us. Thank you and have a nice day.